Aortic stenosis is a narrowing of the major outlet valve of the heart, the aortic valve. And it's a common condition. It affects between 2 and 5% of people over the age of 65.
My name is Peter Mcdonald and I am currently 68 years of age. I was originally diagnosed with aortic stenosis in the mid-1980s when I took part in a cholesterol level survey.
We don't have any medical therapies that can halt or delay progression of the disease. And that really reflects the fact that we understand incompletely the cause of the disease. The only treatment we're left with is major heart surgery to replace the valve when the valve becomes critically narrowed. In our research, we recruited 121 patients with aortic stenosis, and we were interested to use a new imaging technique called PET scanning, which could tell us about the activity of the disease in the valve, specifically looking at two processes, inflammation and calcification, which are thought to be the key drivers of the disease. Mr. Mcdonald, this is your PET CT scan.
Yes.
So I'll just take it.
I was rather surprised by what I saw on the scans. It became very obvious that there was something markedly amiss between the two sides of the valve. I was aware that the stenosis had become quite bad. This was in spite of the fact that I'd been keeping up a lot of fitness.
The main findings were that both inflammation and calcification increase as the severity of the disease increases. But what we saw was that the levels of calcification were much higher than the levels of inflammation, suggesting that that is really the key process driving the valve narrowing. And that's important because treatment strategies to date have concentrated really on the inflammation side of things. And so we're saying that actually we should shift our attention to the calcification side of things, and we may be more successful in developing the treatments that are needed by doing that. British Heart Foundation gave us a clinical research fellowship grant which covered all the costs of the PET CT scans, the echo scans and the follow-up of the patients.
I think the research that goes on here is absolutely vital. I think it's necessary to have other methods of treating this condition, and I'm very glad to have taken part in the research programme.